IVF or in vitro fertilization basically involves 4 steps. First step called as down regulation, second called as ovarian stimulation, third oocyte retrieval, and fourth embryo transfer. In majority of the cases we follow all these 4 steps. In down regulation, the lady is given few pills and at times injections to suppress her pituitary so that her internal system is brought into control, into an outside control for some time. And once this has been achieved, the lady has got her withdrawal. The down regulation is confirmed by doing an ultrasound or at times if need arises by doing certain blood tests. After completing the down regulation, we start up with the second phase which we call as ovarian stimulation. This phase lasts for around 9 to 12 days which varies from individual to individual. During this phase, the prime target is the ovary which is stimulated to produce more and more follicles. However, we target at times around 10 to 15 follicles, not more than that. The dosage of the drugs and the duration of the stimulation, it varies from person to person. During these 9 to 12 days, the lady receives injection almost daily and her response to the stimulation is assessed time to time by doing ultrasound and at times by doing blood tests. And once the stimulation is completed, means once the follicles, desired number of follicles are ready, a final trigger is given. Once the trigger has been given, after 36 to 40 hours, we start up with the third procedure which we call as oocyte retrieval or ovum pickup. Oocyte retrieval is done under slight sedation. That's why the woman is called up with at least of 6 hours fasting. The woman is given slight sedation so that the procedure becomes easy and undisturbed. The procedure is done with the help of an ultrasound wherein a transvaginal probe is introduced into the vagina, and then with the help of special needles which we call as ovum aspiration needles, every follicle is aspirated and oocytes are collected. On the same day, the male partner is called to give his sample, and the semen sample is processed and washed, and the extracted sperms are then used for the fertilization of the eggs. For this fertilization of egg and sperm in the laboratory, we can use either a standard IVF procedure wherein a particular number of sperms are released over the egg, and then these egg and sperm are kept into the culture media, into the special incubators for fertilization. Or else in certain situations where the sperm parameters are poor, or wherein the female partner age is more, or in cases where previous standard IVF procedures have failed, we follow a special technique which we call as ICSI or ICSI. In this technique, we select a single sperm which is apparently healthy looking by using a special equipment which we call as a micromanipulator. Then this single selected sperm is introduced or injected artificially into the cytoplasm of the oocyte, and thereafter it is kept into the culture media for further growth. Once the growth has reached up to a stage which we call as embryo, these embryos are transferred back into the uterus either on day 2 or day 3, which we call it as a 6 to 8 cell stage, or at times for better results we transfer on day 5 or day 6, which we call as Blastocyst Transfers. These transfers are done without any anesthesia because the procedure is very simple and painless. We do ultrasound guided transfer to make sure that the embryos are deposited in areas of maximum implantation potential. This ultrasound guided transfer reduces the risk of ectopic pregnancies and also increases the chances of implantation as we ensure to release the embryos in areas of maximum implantation potential. Blastocyst transfer is a technique wherein the embryos are where embryonic culture are extended into the laboratory for approximately 5 to 6 days. This is a boon for couples wherein multiple IVF have been failed in the past, or where the age of the female partner is more, or wherein we want to avoid the multiple pregnancy, it is preferred to transfer the single embryo at blastocyst stage. Transferring embryos at the blastocyst stage is more physiological because, as we know from our natural fertilization process, that eggs and sperms, after getting fertilized into the tubes, they reach into the uterus once they are at the blastocyst stage. That's why transferring embryos at the blastocyst stage gives a better implantation rate, and also it gives better selection of the embryos, and thereafter the abortion rate and any malformation rate will be comparatively less if we are transferring the embryos on day 2 or day 3.